Hello, everybody, and welcome to The Better Life with Dr. Mariane Pinkston. I am Dr. Mariane Pinkston, and I'm so happy to see everybody today. As usual, I have the best guest that joins me every third or fourth week of the month, Ray Solano from Cedar Park, Texas, and PDLabs, a compounding pharmacy up in Cedar Park, which is near Austin. And Ray and I have another fantastic topic for you today, something that actually I'm not as familiar with, so he's going to teach us both about this today. But as we spoke about it initially, Ray, you blew my mind about this information with Methylene Blue and neurocognitive work. When people have dementia and difficulty with the brain function. So, good morning. Welcome in again.
Good morning. Thanks for having me on today.
As always. A pleasure. So tell me more about this. Introduce us to Methylene Blue and what this does.
Well, what we're seeing is this revolution of taking old drugs and repurposing them in different strengths for different applications. We've talked before in previous lectures about low-dose naltrexone and how it can be used in low doses to have an opposite effect, and it's really important for autoimmune dysfunctions and in reducing pain. Also, another drug that we are seeing that is very popular for getting rid of poisonings from cyanide or carbon monoxide poisoning called methylene blue. Yes, it is a dye. It's not one of those bad dyes that we have seen. It's used in an IV form for these poisonings. However, methylene blue working with a compounding pharmacy in small doses can be repurposed to improve the respiration or the oxygen transport into the mitochondria. We say, well, why is that important?
Right.
Well, it's oxygen respiration is important for the cells for regeneration of neurons and brain energy. If you're many times hypoxic patients just don't have the cognitive ability.
Right.
So many different toxic substances or many chronic conditions and even infections decrease the respiration in the mitochondria. So we're finding this has great applications. But also one of the things when we started really looking at it, the molecule, if we get into a little bit of science here, the molecule is very similar, the parent molecule is to hydroxychloroquine and chloroquine.
Right, or Plaquenil, I think, as most people may know it by. That's right,
Plaquenil, and it's used for parasites and especially malaria as a treatment of choice. Well, then you also say, well, why? We're also seeing some of these other parasitic infections, and the biggest ones that we see is Lyme disease. And many COVID patients have similar symptoms. We think it attacks the body as a parasite.
Right.
This is why ivermectin is effective in some patients and hydroxychloroquine. So as you can see, my goodness, you go down the list you can use for as an anti-aging, as anti-parasitic, and this is why you're seeing this explosion in the use of this drug, methylene blue. And so this is what I wanted to share with everybody, is that this is something that's very safe. It's been around for quite a long period of time. It's difficult to find because right now there's only a few manufacturers in the world that actually make this that is able to be ingested orally for pharmaceutical purposes. So we wanted to make sure everybody knows about it. There's hope for people that are having these chronic conditions. It changes people's lives.
Absolutely. And when you have a mitochondrial deficiency, oxygen deficiency, energy deficiency, there's a lot of different ways to describe it. And, people who have autoimmune disorders, and like I mentioned in the beginning, if you're, beginning to have neurological changes, not able, a foggy brain, not able to think clearly, but losing your cognition, and the ultimate goal is to get those neurons to regenerate, which previously was thought, that we were unable to do that, but we have found that we are able to do that. You have several compounds that you use, the synapsin or RG3 and things like that, and now we can add the methylene blue on top of that. A lot of great studies in neurocognitive work. But like I was mentioning to you before, I am on Plaquenil for my rheumatoid arthritis, an autoimmune condition. I feel like that completely turned me around, in addition to the other things that I am doing and the medications and natural things that I'm doing. So is this kind of a part of an autoimmune, does it have an autoimmune function as well?
I don't notice, from the literature that it does have the people who are suffering from autoimmune dysfunction. But the important thing is that when we increase the respiration in mitochondria, there's so many conditions that the biggest thing is the dementia that we have for possibly the people that are aid in the treatment of dementia, or people that are at risk for dementia. So I think it works in combination, since that is a parent molecule to hydroxychloroquine.
Sure.
I think that it can be used together. But there's a couple side effects I think people should realize.
Sure.
And the big thing is blue. Okay? Then it turns everything blue.
Everything blue.
Everything blue. And we have to take so much care when we compound it that we put it in a special liposomal form that gets absorbed the lymphatic system, and we mix it with a specialty oils, and also we enhance it with alpha lipoic acid to get absorption. So we don't need, the dose needs to be smaller, but all of your poop, your pee, and everything turns blue, or kind of a green. And the capsules, you got to be careful with your hands, because it can turn them blue as well, because we do the best we can. But it's just to people to realize that it is kind of staining. But so just be careful.
Just don't be shocked.
Don't be shocked. That's right. Everything's going to be a little blue for a while.
Exactly. Oh, that's interesting. Is it something that you take every day, lifelong? How do you take it?
Well, it's very dependent on the patient in their chronic conditions. What we find is many times to eradicate some of these people with Lyme disease, it may be 3 to 6 months therapy until you can start out sometimes at a very low dose. We usually start out at 25 milligrams and every other day, and then you work your way up until you can tolerate it, because sometimes, as you see, it can have this Herxheimer, it can make situations or conditions worse, so you have to go slower.
Gotcha.
So it just depends on how long the therapy is, determined how sick the individual is. But usually 3 to 6 months is a program. But gosh, the alternatives, there, many times long-term antibiotic therapy have been used, and so many very, very expensive, costly remedies have been out there. So that's why we find this to be very helpful for patients, because this has been revolutionary. They get their lives back.
Yes, which is something I think most all of us are looking for, is get our lives back, get our energy back, get our brain back, and functioning. It's amazing. And you mentioned the Herxheimer's reaction. I know we've talked about this on the show before, but as you said, it is taken for somebody who has a toxic overload of certain, like the cyanide, lead, things like, I think you said lead, things like that That's are, in the body. And so when you take something like this, your body begins to release those toxins into your bloodstream. And so initially you can feel a lot worse before you feel better. That's why you start low and start going up slowly. Is that correct?
Oh, that's right. We're not really sure as to what is going on a cellular basis when we're taking it as far as the excretions. But we do know that many therapies that we have to tailor it and go slow. This is the reason why it's so important when we work with patients to personalize the medications and personalize the therapy, because one shoe doesn't fit all, one therapy doesn't fit all. So it's really important to come up with a treatment plan that's best for you. It is somewhat dependent on weight.
Okay.
Where some of the literature is based on kilograms. But we find out to take a very slow approach is a great universal, dosing schedule for most patients.
So what are most of, and we've mentioned dementia, there's long COVID that patients have a lot of neurological effects from COVID and other types of viruses that are out there. What other places can this be used?
Well, this is the biggest push right now that we have seen is for the neurodegeneration. We have recently, the FDA just recently approved another drug that chases the plaque in the brain for Alzheimer's.
Yeah.
Which we do know that this plaque that we put in the brain is usually the body's defense mechanism from an infection. So when we remove the plaque, sometimes we have all these serious side effects. This is where people stroke out and because you're fixing the body's repair mechanism.
Gotcha.
But this is something using a completely different mechanism by going to the root cause of the problem when we're choking off respiration of the mitochondria, especially mitochondria in the brain, everywhere.
Right.
So I think it could be a long-term effect for people that have many genetic predispositions to neurodegeneration,
right,
or have had lifestyle choices that cause many of the neurodegeneration risk factors and toxic exposures or traumatic brain injuries, things that have had difficulties in the past that it can accelerate it. So I think that's probably the most exciting.
Really?
But also many of the parasites that we see, that especially Lyme disease, the Babesia, these parasites, they seem to morph and they change.
Yeah.
And it ends up being extremely complicated as to how to treat them.
Absolutely.
So this seems to work against them, that they just don't know how to react when they see these methylene blue molecules. They seem to stop the replication.
Gotcha. Interesting. Wow, that is incredible science. So, do you feel like it is preventative in any way? Should people wait until they begin to see minor symptoms, or, like you said, a genetic predisposition? So, is there any way to do this preventatively?
Well, this is what the new literature recently is talking about prevention for dementia, which is kind of is exciting,
right?
Because there's not a lot of oral medications. There's a lot of supplements that can be used for these risk factors for dementia. So this is what we're seeing, this huge surge in some of the literature about. The thing that we'd like people to do is be able to make those lifestyle changes at the same time, because we're all in a pill society, right? You just take a pill and everything's fine. But I think you also have to always make sure that you, for people that have those risk factors, unfortunately, sugar is probably up there too.
Absolutely.
To really making a terrible dietary choice to really accelerate that mitochondria decline.
Absolutely. So we hammer it over and over how we need to live well, eat well, move well, exercise, all those things, sleep well, lower your stress, and now we can add mitochondrial rejuvenation. This is all part of prevention and anti-aging and all of these factors. So let's say somebody's interested in doing this. How do they go about getting it?
Well, I think as a first start is practitioners that are trained and be able to do that, and they would get in touch with us, and we can be able to link them with practitioners that want to know more about it or that have experience in prescribing. It's very safe.
Yes.
Very easy. It's not a risky therapy.
Absolutely.
And just give us a call at, our phone number is 888-909-0110. Or our local phone number is 512-219-0724. Or our website, I think you'll find it very informative.
Right.
PDLabsRx.com.
Absolutely. Which is on my site. So I have all of that information because you guys have been so kind to sponsor and take care of me all this last, almost 2 years now. And
can you believe that? 2 years?
Unbelievable, right? It goes like that, but you guys have been so good to me. And so if you go to drpbetterlife.com, you can look up all of the platforms that you can find Ray and I and all of our past shows, and that it will be on YouTube, all of the podcast platforms. Of course, I'm on San Antonio Radio every Sunday at 4 p.m. And then you can also find all of the information about PD Labs, pdlabsrx.com. And Ray, you and I work on a platform, Metabolic Code, together, which patients can be seen by me, and I can provide a lot of the things that your pharmacy provides, a lot of fantastic therapies that are out there. But again, you mentioned that this is a very personalized, type of therapy, and that is what we do through Metabolic Code, is offer a very personalized type of therapy for whatever you are looking to accomplish with your health. And so how do they get in touch with us through Metabolic Code?
I think the best thing is to give us a call at the pharmacy, sure, and we'll be able to direct you to the right professionals, and also our lifestyle medicine clinic. We'd be able to help you get some of those answers. I think the thing that, if I could just differentiate the difference, is so many of these telemedicine sites that are out there are really plug and place for a particular drug, that they are really not helping the patient. They are just really looking at one particular drug, and be able to be able to plug and play, so to speak. It's a little bit different here, that we're able to get to the root cause of many conditions. Absolutely. And really truly practice integrative medicine, as opposed to just trying to use it as a marketing tool. Absolutely. To
make some money, right?
For commerce, for making more revenue. So I think that's important to differentiate. We have a team of medical professionals, I think, that are some of the best in the country. Absolutely. If we don't have the answers, we'll find somebody who has the answers. Yes. I think we've got a great network of trained professionals that specialize in certain areas. So it may not be here in Austin, but it may be in Chicago, or it may be in New York. But we're able to link up and have a network of people that can give you a lot of answers. Absolutely.
Well, we are going to take a very short break, but if you guys want to reach out to Ray and join on the Metabolic Code, pdlabsrx.com, or go to my site, drpbetterlife.com, and we are going to be back in just a moment.
Hi, this is Ray Solano with your Healthy Choices Minute, sponsored by Prescription Dispensing Labs. New research has concluded that implementing dietary changes could prevent gut inflammatory processes involved in some chronic diseases. Modulation of your gut microbes through diets enriched with vegetables, legumes, grains, nuts, and a higher intake of plant over animal foods has a potential to prevent intestinal inflammatory conditions at the core of many chronic diseases. In short, the foods we eat in our dietary patterns have a major influence on our immune system that can cause many conditions we are suffering from today. Solution: try our OptiMeal Shake. Our team has developed the best tasting, healthiest shake you've ever experienced to control blood sugar and to improve your gut. Start your day today with a healthy choice. Call us today at 888-909-0110 for a free sample of the OptiMeal Shake. 888-909-0110. Remember, you have a choice in healthcare.
Welcome back. I'm Dr. Mariane Pinkston here with Ray Solano today of PDLabs, and we are discussing neurocognitive disorders such as dementia and other effects that occur on the brain. And we were talking about methylene blue, but you had mentioned that there are a couple of other things that can be used with it that might help in neurodegenerative issues. And I think you mentioned something to me about VIP. Tell me a little bit more about these things.
You know, vasoactive intestinal peptide it seems like a mouthful, and it has when you say those words, they go, wow.
Right.
What's it have to do with intestinal? So it's really a misnomer.
Yes.
It's a drug that's used in Europe for pulmonary issues of many times when they have pulmonary hypertension, or they have many types of pulmonary disorders.
Okay.
It's used in an IV form, and here in the United States, we're able to develop it into a nasal spray.
Right.
You know, VIP is a hormone. The receptors all throughout the body that are critical for your immune system. This whole network of your immunity called the mesenchymal system. Mm-hmm. That once we turn this on, the body's intense regulatory immunity comes back to normal.
Wow.
You know, many times that people are having sleep dysfunctions, they're having chronic fatigue symptoms, they're having hormonal imbalance. Right. When your immune system is disconnected, so to speak, all these things, these chronic conditions come into conditions. But the choke point is the vasoactive intestinal peptide hormone levels.
Right.
So when these levels are low, it causes a reaction downstream, so to speak. So many times when people have these chronic mold conditions and chronic Lyme conditions, this downregulates their VIP levels. So when their VIP levels are normalized, then they are able to erase that memory of that reaction. So it's an important factor. It's an important drug. It's a off-label use, so to speak.
Sure.
But it has to be specialty compounded.
Yes.
And the doses have to be personalized to the patient. Very safe.
Yes.
Can be used with the methylene blue for patients, but many times this is another one of those drugs that people get their lives back. They feel normal. They're able to get out of bed. They're able to function, get their energy levels back to normal.
Amazing.
So this is it's a nasal spray, a very small amount that is used, and something that just has to be refrigerated. But it is probably a 3 to 6 month program, okay. And depending on the physician, the practitioner, it's something that can be very safe, but it has to have the right dosage. So that's back to personalized dosing again.
Exactly, which is what we do, and I love so much. You have so many things in your armament to attack so many of these things that patients are suffering from these days that contemporary medicine just doesn't seem to address. You seem to want to focus on a more pharmaceutical type of therapy and kind of a algorithm of, check boxes, and if you fit this list, then this is what you get, and it's the same for everybody. And I love that we practice a very different style of medicine and are able to target to the level of where people are having their difficulties. We are all different and we all have different needs. And so this is wonderful. So in our last couple of minutes, tell us again how to get in touch with you and how to start this process.
Well, check out our website. I think you have a lot of educational pieces, also our podcast and some of our TV spots. It's PDLabsRx.com. It's full service compounding pharmacy. The specialty formulas that we've developed. That's PDLabsRx.com, and an online shopping store as well for some unique supplements.
Yes.
But we're also a phone call away, 512-219-0724. And we've got a team of professionals that can kind of connect you in the right direction. Especially in our lifestyle medicine clinic, we team with Dr. James Laval, and to make sure that his protocols are trained to our medical team. So I think it's something that people are going to be seeking. Lifestyle medicine is the new area of medicine.
Yes, and I love it. And I practice with you guys and see some patients too. And so you can go to drpbetterlife.com. Not only find some of our previous shows, but also some of the shows that I have done on metabolic code and lifestyle choices and things. And so drpbetterlife.com. And also you can reach me in Northwest San Antonio at 210-698-7825. Another website you can go to is pinkstonfamilypracticesa.com. That is my private practice information. I see patients with and without insurance, and also have a weight loss clinic that I am working with now, and also that is with PDLabs. So PDLabsRx.com, drpbetterlife.com. Please reach out to us because these are very, very important compounds. I hate to say drugs. They are administered like drugs, but they are great compounds, have a much more natural base, target what is going on underneath, for the actual problem that is going on underneath, rather than just trying to put a Band-Aid on your symptoms and just kind of push you to a better quality of life, not so much quantity. But we definitely can help you with that. So, Ray, as always, it's such a pleasure. Thank you so much. I know you always bring amazing information, and so you guys have always been a big support to me as well. So thank you. And any final words before we go today?
I think the most important thing for people to do is to take responsibility for your health.
Absolutely.
Don't let others convince you that it's in your genes and you just have to suffer and take 15 pills a day and that's the way it is. So I want people to realize there's hope and there are answers out there, and I want people to just take charge of your health because it is probably more valuable than a whole lot of money sitting in a bank account.
Absolutely. I couldn't have said it better myself. Thank you. Very nice. All right, Ray. Well, we will see you in a couple of weeks, and thank you. And everybody have a great week out there.